Next slide, please. So today we're going to hear from Shauna Welsh on how Mercy Health in West Michigan uses a multi-prong approach to build the skills and address the barriers to advancement that some of their incumbent workers are facing, and then also to simultaneously increase their diversity, equity, and inclusion goals. We're going to start with a brief overview of CareerSTAT and of Mercy Health, just to give you all some context, and we're going to follow that with an interview with Shauna to learn more details about their program. And of course, you all are strongly encouraged to chat questions that you might have throughout the presentation so that we can field them and get those in as well. So if you have tuned into some of the previous webinars, you are going to be familiar with this next bit. So please hold tight while I get everyone up to speed for some folks on the call who haven't heard this spiel before. But CareerSTAT is an initiative of the National Fund for Workforce Solutions, and it is an employer-driven network based on peer exchange. The National Fund CareerSTAT network includes a range of healthcare employers across a continuum of care, and it also includes industry partnership, workforce development partners, and philanthropic organizations. CareerSTAT, of course, is free to join and open to all who have interest in healthcare workforce development. The Frontline Healthcare Worker Champion Program is a pillar of CareerSTAT and was created in 2014 by a group of healthcare industry leaders who are interested in encouraging and recognizing peers making sustained investment in their frontline. A peer committee defines the criteria and the status determinations. And thus far, CareerSTAT has recognized over 50 healthcare employers, including 9 organizations that were publicly announced last week. So hit me with the next slide. These all were formally announced last week and will be formally recognized, publicly announced last week and formally recognized next week at the National Fund convening. Next slide. And the reason I talk about the Champion and Emerging Champion organizations is because they heavily inform the CareerSTAT Guide to Investing in Frontline Healthcare Workers. And this guide offers organizations evidence-based best practices for implementing workforce investments and integrating them with business goals. And in 2017, Emerging Champions, which are organizations who meet some but not all of the criteria put forth by the Recognition Committee, were invited to participate in a year-long peer learning academy to accelerate the adoption of some of those best practices. And Mercy Health was one of 11 organizations to participate in the first cohort of the academy. So I am excited to have them on the line today to share more about best practices that Champion and Emerging Champion organizations use to invest in their frontline workers. So now I'm going to turn it over to Shauna to share a little bit more about Mercy Health.
Thank you, Melissa. I appreciate the opportunity to be on the call today and to share with many of you, as I have learned from probably many of you on the call. So just on the next slide, before we get started in the interview with Melissa, I want to ground us a little bit in who Mercy Health is and the organization that we're a part of. Mercy Health is one of the healthcare systems that belong to Trinity Health. We're a member of Trinity Health, and Trinity Health is the second largest health system in the U.S. We have almost 139,000 colleagues over 22 states. And for my TA folks, talent acquisition folks on the line, we do about 32,000 hires per year. So we're very active in our hiring. Within Michigan, the circled area there, the mitten, Mercy Health is within that, the Michigan region. And so we have, within the Michigan region, we have just under 24,000 colleagues. And the particular health system that Melissa mentioned today, Mercy Health in Grand Rapids, has 4,400 colleagues, and 21% of them are self-reported are ethnically or racially diverse. So we know a high percentage of them are in entry-level roles. So our organization is very committed to equity, and part of that equity strategy is really advancing the frontline worker, where a lot of that 21% of diverse individuals are sitting today, helping them kind of get on the career path, skill up into middle skill jobs and beyond. We also know that in doing this, advancing the frontline worker to middle wage jobs and beyond, that we need very sustainable partnerships. And so we're going to talk a little bit about those partnerships today, but we do have multiple partnerships that we now view them as a collective impact team. So you'll see many of them on the slide here, but our West Michigan Workforce Board has really played a very strategic role. They are oftentimes our convener in this work, bringing together multiple stakeholders, including our competitors. We want to make sure that the programs that we are developing for our communities are sustainable, and that means partnerships with our competitors as well. They also hold our apprenticeship programs, which has been really helpful for us as we're building out various apprenticeship programs. And then you'll notice on this slide also education and training partners. They really are there to come alongside of us to make sure that we have the curriculum that aligns to the skills that are needed to support the creation of innovative work-based learning and the programs that, that we provide for individuals at the front line and in our community. So other partners that you'll notice on this slide are partners like the Literacy Center and The Source. They really help us remove barriers such as literacy gaps, transportation, childcare, housing, things like that that have an impact on our colleagues when they show up. We're looking for not just individuals that are coming to work, but we want to make sure that we're coming alongside of them and offering them the support that's needed so that they can be a really highly engaged employee. And then most recently, and I think we'll talk about this in some future slides, is we've had an opportunity to launch a brand new career development center. And that really was supported by our CareerSTAT journey. And so when we received the Emerging Champion Award and was able to go through the year-long academy, it really helped us think through what is the next step that we can take to ensuring that we're advancing our frontline workers and giving them sustainable skills. I think you're on mute, Melissa.
I was on mute. Thank you for that. So thank you for the overview on Mercy Health. We really appreciate that level setting. And going back a little bit in time, so in 2017, CareerSTAT published a case study about Mercy Health, and it was explicitly around how you use data to drive frontline workforce investments in hiring and to reduce implicit bias in hiring. And I would love for you to tell us a little bit about that data set and, you know, the work that you did to reduce that implicit bias, and then how data has influenced the decision to really invest internally on your incumbent workers.
Thank you. Thank you for that. Yeah, so you're absolutely right. About 10 years ago, we started on the journey to redesign our hiring practices. We wanted to make sure that we were using a fair, objective process that would help us ensure that we were putting the very best individual in front of our patients. That was our primary goal. What we found in doing so is that it really helped to remove some of those implicit or unconscious bias that exist in a lot of hiring practices and exist in the overall process itself. You know, we don't know where they exist, but sometimes there's these barriers to ensuring that we're hiring the very best person for the job. And so that really became very foundational for us as we began to significantly increase the number of diverse individuals that we were bringing into our organization. Once we realized that we were starting to approach workforce equity, that our colleagues, the overall diverse population was really starting to mirror our community. We then had to peel back another layer and say, where are those individuals sitting at today, though? Are we at job equity? Are we at pay equity? Are we ensuring that these high number of diverse individuals that we're bringing in, are we ensuring that they're not all at the entry level, that they are filtered throughout our organization, so that no matter where you're walking at, no matter who you're interacting with within our organization, and no matter who you are, you can see yourself represented. So that evidence-based selection process really became foundational, and it still is foundational for us to then launch into the evidence-based career pathways and the evidence-based career coaching.
Thank you. Can we go to the next slide, please? Did you want to talk a little bit about this, Shauna?
Sure. So one of the things that we track, and this is somewhat of a high level, we are constantly looking at, again, to the point that I made earlier, where are our diverse individuals? We're looking at job families. We're not just looking at the number of diversity that we have within our organization, but where exactly do we have the greatest opportunity to ensure that we have diversity represented across our organization and across job families. So this is just one slide that we use, again, at a very high level. This was actually one that I shared with our Board of Trustees recently. They could relate to the smiley faces. They said, tell us more about what we can do about the orange, curious looking smiley faces. But it does get the point across that we have opportunities in certain areas. And so, there's many layers to looking at this. When we look at, our RNs, they are the ones that are within the acute care setting that are at the bedside of our patients. So it's really important to understand what career path can we develop within our organization to get some of our frontline entry-level workers career path into an RN role, if that's of interest to them. Because we know that we have underrepresented populations within that role. So really kind of peeling back the percentage of diverse ethnicity in our organization helps us design those career paths for individuals.
Great, thank you for that. And then I'm also curious whether or not data informed the decision around creating this on-site career center.
It did. Actually, it informs it quite a bit. The Career Development Center is in partnership with two other organizations that we'll talk about, but most importantly, one of our funders, and that's the WK Kellogg Foundation. They have a real vested interest in the zip codes around our hospital where there's underserved, underemployed, unemployed individuals, or individuals that are commuting outside of their living zip code for jobs. And so when they came to us and asked us if this was something that we would be interested in doing, the first thing we wanted to do is really understand our data. How many of those individuals are already employed within our organization? How quickly, how fast are we actually employing individuals from those zip codes? That was really informative. Data really informed our decision to launch the Career Development Center. At St. Mary's alone, we have over 950 colleagues in entry-level jobs, and we look at the entry-level jobs and the pay, and these 6 job families are the ones that we're most focused in. And they have the highest diversity, sometimes the highest turnover, due to different barriers that individuals are facing in those jobs. And we have a really great opportunity, and quite frankly, I would say a responsibility to make sure that we're giving them opportunities and options to advance. So when we were honored with the Emerging Champion Award through CareerSTAT and was able to go through that year-long academy, learning from some really great organizations and what they're doing, we knew that we wanted to create a program that advanced our frontline workers and improved our wage equity, and provided a path to family sustaining wages for our colleagues.
Great. And so you did mention, alluded to the collective impact team and your number of partnerships to do this work. Can you tell me a little bit how they might be different than your standard partnerships?
Yeah. So for us, our standard partnerships, and there's vast partnerships, I think, across any healthcare organization. We have lots of community-based organizations. We've got educational partners that want to come alongside large organizations like the ones that all of us represent on the call today. A lot of us represent organizations that are like kind of anchor organizations and communities. And so they want to partner with us, whether it's to help, help them work with their participants to get jobs, or sponsor certain, job ready events or whatever that is. But we really wanted to take a step back and really understand what strategic and collective partnerships look like. And so in doing that, we were able to really focus in on what are some of the key things that we're going to need to advance the work that we want to do around frontline workers. And that's, education and training, literacy, employee support programs, that kind of thing. And then, we reached out to some of those partners, and some of them were partners that have been doing work with us for quite some time. We reached out to them to talk a little bit more about the intentionality. And so that's how we kind of formed this more collective impact type of team. We still have a vast variety of partners, but not everyone is at that strategic table helping us to really advance the frontline workers. Some of them we just use when we need them. We reach out to them for partnership. So within our career development services and where our collective partners, collective impact partners are coming in at is, the evidence-based career coaching, our community resource alignment, making sure that our colleagues and those that are seeking employment with us have resources available, transportation, childcare, removing some of those barriers that we discussed earlier. And then workforce programs, where our internships, externships, apprenticeships, our training partners that have access to individuals that could benefit from a short-term credential program. And then in partnership with our organizational development team, looking at, again, getting them to that middle wage job and beyond. Well, the aspiring leaders is beyond, because we also know, and we don't need to go back to the slide, that we have underrepresentation in leadership roles with people of color. So our organizational development team is looking at how do we, not only move them to middle wage jobs, but beyond, how do we create leaders, more diverse leaders in our organization? And then the Rise Up program is the one that we've been talking about in regards to the Career Development Center. So we launched the Career Development Center, and within the Career Development Center, we have the Rise Up program. And again, I just cannot thank CareerSTAT enough for their partnership and bringing us along on this journey. It really helped us kind of think about what is it that's needed to advance our frontline workers. And the Rise Up program was adopted out of the fact that we had this grant. We were part of a year-long academy. And we challenged ourselves, what do we want to do with this to make a long-term sustainable impact? So the Rise Up program really is going to impact 450 lives over the life of the Kellogg grant, which is $1.72 million. And those 6 job families, providing career paths and middle skill learning opportunities to get to middle skill jobs, I should say. That's 50 colleagues a year over 3 years. And then 100 individuals per year over 3 years will come from our communities, those that are living in the shadows of our hospital, and helping them kind of understand what opportunities exist in a healthcare system and helping them get there. So if we go to the next slide, I think we'll drill down a little bit more around our community partners. So we've borrowed that outside in, inside up approach. And West Michigan Works is our outside in. So they're our workforce board. They actually have service centers that set in the communities of the individuals that we're trying to reach. They'll be reaching out to them, working with them as a point of contact, providing them that outside in career coaching, helping them understand what roles they're interested in, how do they skill them up, offer educational programs, funding, that kind of thing. And then helping individuals navigate our application process. I mean, I can't remember the last time I actually had to fill out an application, but I know that every system I've ever looked at as a talent acquisition leader, there isn't one out there that isn't complicated. So really helping individuals within our community navigate that application and applicant tracking process. And then the next slide talks a little bit about the source of the organization that we're working with. They are actually helping to remove barriers, not only for our own colleagues, but for those that are getting themselves work ready to come and work within our health system. So we know that the bullet points on this slide are ones that really hit home quite often for that population that we're looking at employing, or ones that we're already employing. The child care, the credit building, elder care, things like that. And then we're going to go to the next slide. Again, that kind of inside up approach. Mercy Health will be focused on these particular job classifications. So not just the individuals that are residing in them today and working for us, how do we help skill them up to get to middle wage jobs? But we know that many of the individuals from the outside that will be coming in will be able to backfill some of these roles, because they will have, some of them will have minimal skills. Maybe this is their first job, or they've been out of the job market for a while. So we will backfill these roles with individuals from our community. And then the beautiful cycle continues. As we're backfilling them and they're coming into our organization, we'll start working with them and skilling them up. And then the next group will come in. The primary objective, as kind of mentioned earlier, is that advancement and retention of our colleagues, employment opportunities to in-demand jobs. I don't think a lot of people understand what in-demand jobs are in our community. A lot of times they think, if you work for a health system, you're either in food and nutrition or you're a nurse. There's so many opportunities in between there. So increasing diversity in those middle wage jobs. And then part of our mission is to serve as a compassionate and healing presence within our communities. And this program and our career development center help us do that.
Okay, so I'm going to pause there and ask a few questions from the chat. And one is around the internal capacity. And I know that this was a big issue throughout the academy, but did you have to build internal capacity to collect and analyze data? And if so, what did that look like?
We did. We were really fortunate to have a dedicated data analyst on our team that is incredibly smart and also very passionate about the work that we're doing. So she really helped us focus on and peel back some of the data that we needed to support the ask around workforce programs. So that was really helpful. And then just building capacity to scale some of this work. There was some of that. I, as a TA leader, had to do a little bit of shifting of some of the team members that I had on my team. And then there was an ask to add 2 additional resources, a career coach and a project coordinator, to help us scale some of the work that we're doing around workforce programs.
Great. And then, so we have a specific question around access. We have 2 around access, and one is around criminal background checks. And it sounds like someone on the line has an affiliate, a Mercy affiliate in Des Moines, in Iowa, and that they are known for having a little bit more of a higher threshold for background checks. And they're wondering if Michigan hospitals have similar policies and if they've hindered any efforts regarding hiring frontline workers.
Yeah, that's a great question, and a journey that we continue to be on. In Michigan, what we've done is, yes, we follow the Trinity Health guidelines, but those guidelines sometimes, some of them are really black and white, but then there's this big, huge gray area. And so what I've done, and again, this isn't sustainable long term, so we're looking at how do we approach this differently. But what I've done as the leader is if we have a certain background that comes back, I actually review it as a leader myself. And because we have an evidence-based selection process, we're able to look at this candidate more holistically. So if something does come back on a background check, we can say, okay, well, let's take a look at, how did they fare on our job fit? Where are they at on the job fit scale? Do they have the cognitive ability to do the job? How did they score in our structured interview guides, or on our structured interview guides that we use during the talent acquisition and the hiring manager process? So we're really kind of looking at that candidate holistically, saying, does it make sense for us to move forward with this based on this particular violation or infraction that they have on their background? So we've been able to do that. There are broader conversations taking place because we also know that there's a lot of data around the fact that, individuals that have, made some, maybe some not so great choices in the past, doesn't mean that they're going to be repeat offenders in certain cases. In many cases, individuals that come in that have criminal backgrounds are some of our best workers that, they appreciate the second chance. So we're working through some of that, but as the leader, I actually lay eyes on every single one that there's a concern with and make a decision.
Great. So we have a few more questions, and I think we might be able to get to one more, maybe two, but I'm going to do our best. And one, you mentioned that you are using your partner organizations around helping build adult literacy. Can you talk a little bit more about how you address literacy issues?
Yeah. So we actually are, again, starting on this journey and discovering more now that we have the intentionality around our Rise Up program and our Career Development Center. The Literacy Center that we work with in West Michigan, when we identify that we have a gap in literacy with either an existing colleague or someone that is wanting to come into our organization, we partner with them on programs and classes that are available. We had a real recent incident that I was just very proud that we were able to overcome in partnership with our Literacy Center. We actually acquired an organization that was doing some of our environmental services, our off-site environmental services, so for our physician group and some of our offices that are not attached to the hospital. We used to have an outside organization that provided those environmental services, janitorial services. We acquired them. We wanted to bring everything in-house so there was consistency, around safety and cleanliness and all that kind of stuff. So there was an individual that was just a really kind of stellar worker and wanted to be acquired as an employee of ours in this process. And so we found out that he had some real literacy gaps and almost really couldn't make it through the application process. So we quickly reached out to our Literacy Center and not only got him plugged in, but we took the chance and hired him. Hired him based on the fact that we connected him with our Literacy Center and that he's going through programs very successfully. And so that's just one very personal way that we have partnered with them. We're also looking at and have some commitment to do some on-site classes with the Literacy Center. So it's accessible for individuals that need it.
Well, thank you so much. We are towards the end of time. So unfortunately, we weren't able to get to all the questions. And I think that there are so many great things in this conversation. We could just keep going. And that is the idea of CareerSTAT, that folks can connect directly with each other to learn more. Our next opportunity for peer networking is the National fund convening that's taking place in Dallas next week. I do hope to see some of you there. I do want to give a quick shout out for a survey evaluation that is posted in the chat, as well as the Mercy Health case study that I mentioned at the beginning of the webinar was also sent out through the chat. So please take a look at that for more information on Mercy. And then also I will take some of the questions that we have here and share them with Shauna and figure if we can find a way to get those questions answered. So again, thank you all so much for your time. Thank you so much for Shauna for putting this presentation together and sharing all the lessons that you've learned so far. And I think that's it. Just ending up on a thank you to everyone. Much appreciated.